What is an accessory nipple and can it be removed? I've never heard this term. So I'm
Oh,
reading the question. I'm like, well, what's that mean?
no,
Is that when somebody who's born with an extra one?
correct. So an accessory nipple or a supernumerary nipple, that's the term that we use. It's an additional nipple. It's an extra nipple. So yes, it can happen. As a matter of fact, it's more common than what we think it is
Mm,
because we are, if you think about it, we are mammals, right? And we have something called the mammary line. So the mammary line is a line that comes through the axillary region and then goes through the breast, comes down through the abdomen and into the groin. And along that line, there can be an accessory nipple. And that looks either like a full developed nipple or that looks more like a mole, like a little birthmark that you can actually touch and feel. Now, I said it can look like a fully developed nipple, and it can along that line. And also, it can come with a fully developed breast. So you can also
really?
have accessory breasts along that line. And I mean, the most common place to have them is in the axillary region. And
So kind of the armpit
kind of the
area.
armpit area. So you would have it. You have an accessory breast with a nipple and an areola. That's much more uncommon. But
Mhm.
having accessory nipples along that line that are tiny and small, and patients probably and most likely never knew that that's what they were. They already, I mean, always thought that they were like a little beauty mark or a little mole.
Interesting.
It is possible. And then there's another last name to that supernumerary nipple. You can have a nipple that it is ectopic. So that means that it's a nipple that lives outside of that mammary line. So a nipple that you develop that's in an anomalous place to develop it. And the most common place is in the anterior thigh,
Really?
in
Anterior.
front of
Okay,
your leg.
anterior. Oh, front.
Anterior, just in front, the
Okay.
front of your leg.
Well, who knew?
That
I
who
guess the
knew?
people who have it know. You'd be maybe pretty aware. So then what
Correct.
do you do when all these random nipples show up? How do we again, I
And
think the percent is probably really low, but
right,
what is do you just remove them and close it
you
up?
just yep, you just remove them